Fellowships are important to the LRCP in order to drive the academic and education mission of the cancer program. Fellows at the LRCP are responsible for seeing patients in clinic in concert with the oncologists, training of medical students and residents, as well as conducting research. All clinicians who go through residency programs and fellowship programs are benefiting from the experience of others, and so essentially what we're doing is training the next generation.
My fellowship is a two-year fellowship that was a combination of a clinical aspect and an educational aspect. The clinical aspect was focusing on GU oncology. That's really genitourinary. So I looked at treating patients with kidney cancer, testicular cancer, bladder cancer, and prostate cancers. And the educational part of the fellowship involved me doing a master's in health education.
So my fellowship experience is focused on looking at better ways to treat lung cancer, particularly lung cancer that is spread outside the chest. It's called metastatic lung cancer. We know that some patients with metastatic lung cancer can have long-term survival. The average patient has a very poor survival, but we have some research to show that there are some patients who benefit from aggressive treatments.
What it meant to me personally is that it gave me an opportunity to enhance my learning in a very, very specific area of knowledge that's not a very common area around the country, certainly, and really not a big area in the world. So it gave me time to hone my clinical skills while treating a lot of these patients in these different clinical areas. What it also meant is that it gave me the opportunity to finally realize what it is that I wanted to do with my life.
I think I've gained a lot more confidence as a clinician in my abilities to diagnose and treat lung cancer. I've gained experience in research, clinical research. I've presented my findings at international conferences, and I've generally, my clinical, my research skills, I think, are much improved compared to this time last year, and I feel much more confident overall as a physician.
We're finally realizing in this world that not all cancers and not all patients really can be treated the same way or with the same recipe, and individualizing care has become one of those new terms that everyone likes to throw around, but I really do believe that this is one thing that I've been able to accomplish in this fellowship, and I hope to continue to accomplish as life moves forward.
So I chose to come to LHSC simply because the LHSC actually has several internationally renowned experts in the field of lung cancer, and lung cancer is where I chose to do additional fellowship training. So this was the place to come in terms of the clinical and research experience that is unique to this center.
Not only are you helping an individual, by helping one individual who's decided to dedicate their life to a more selfless cause or an even bigger cause, and that is helping care for patients with these cancers, regardless of what the cancer site might be. Your small action, however small that may be or however generous that may be, will have a domino effect on other patients' lives.
Really, I think the most important aspect of it is the fact that I will be able to take things I've learned here to another center, and I think patient care at that center will be improved as a result of my training here and my abilities, the things I've learned in my fellowship. So that would be, I think the healthcare system as a whole really does benefit from people doing fellowships.
Donor support for the fellowship program is critical in order to provide this financial support for us to attract the best fellows from North America to come here to London.
By making the decision to even consider donating to this cause, you've already taken the first step, and probably what I would think is the most difficult step, and I thank you for considering that.